Well, good evening and a warm welcome to UBC News Tonight. My name is Sharon Kyomugisha. In our top stories of the day, Arua Regional Referral Hospital is running out of oxygen to manage COVID-19 patients and others in the intensive care unit due to a rise in COVID-19 cases in the region. The oxygen shortage is an additional challenge to 36-bed capacity at the COVID-19 treatment center. Chances are high that soon the treatment center may run out of space. Details for
While speaking to UBC TV on Friday, Arua Director Dr. Philbert Nyeko revealed that the hospital only has oxygen to cater for 2 patients in the whole hospital.
The oxygen capacity will be surpassed. Our ability to provide oxygen for the hospital and the region would fail if we get just 2 more patients on oxygen.
With this disturbing situation the hospital is embroiled in amidst increasing COVID-19 cases, the hospital management is now advocating for West Nile districts to consider home-based care for mild COVID-19 cases to create more space for those in critical condition.
Manage home-based care to take care of the asymptomatic and the mild cases and some of the moderate cases, only referring to us the severe cases so that we can take care of those ones.
In the COVID-19 treatment center is also a woman who has given birth, while another is expected to deliver any time from now, who all need oxygen supply. Despite the alarming fears about COVID-19, many people in Arua City are still reluctant in observing SOPs and wearing masks while in public places. The Bishop of Madi and West Nile Diocese Right Reverend Charles Collins and Daku stressed the need for the general public to adhere to the presidential declaration during the 42 days.
Death cases have increased, which is worrying. The infection continues to increase, yet hospitals and health facilities are full, sometimes with no capacity to handle the patients.
In more stories, many passengers have been allowed to freely cross from one district to another on the first day of the 42-day inter-district crossing ban. Although the ban was intended to limit the spread of COVID-19 through limitations in human movement at different district entry points, the emphasis was more on means of transport but not on passengers. Onyango Jackson has a detailed report on this story.
The 42-day inter-district border cross movement suspension has come into effect this Friday as a stop measure against COVID-19. On major highways in the Kampala metropolitan area, hundreds were left with no option but rather to opt to footing.
Entambula tulinyeko motoka netujja tutukaali driver natugamba mufulume
bakati tuva mu radde tulina omulwadde ali bubi naye ate batukozesa bino birwadde bro.
This is Namagunga, located along Kampala Jinja Mukono Express Highway. It is at this station that the Uganda police has manned a cut-off point to restrict movement of people from both districts. However, the question remains, as you can see, a section of people moving on foot from Buyukwe or Jinja side crossing to Mukono side. This leaves a lot of questions as to whether the essence of restriction of cross-border movement will be reached or maintained.
Mvudde lugaze naye ngedako mbalala tata wange mulwadde ngate kinkakatako genda
nende kulaba nga babuuza weyambadde masiki kyokka naye ngate amazima gali nti ovonga ovweri nodde eno teri mazzi gonaaba mu ngalo.
At Sezibwa Trading Center, a few meters away from the bridge along Kayunga Mukono Highway, was also the cutoff between Kayunga and Mukono districts. Here, the same trick of passengers crossing from either sides on foot was applied as police nearly looked on. Just like at all other cut-off points at Kawanda along Gulu-Kampala Highway, border operators and pedestrians crossed without any interference from either side.
Public transport This is not the only disease we are having in Uganda. There are very many diseases. They will let us work with those diseases. It's me who knows. If it catches me, it's me who knows. The much energy and the emphasis they have put on COVID, why didn't they put it on AIDS and other diseases?
However, unlike the previous days where a heavy traffic is always the order of the day, this time round it was a bit a relaxed day for those driving to Kampala and from. The inter-district movement embargo will run for the 42 days beginning this Friday. Robert Onyango, UBC News, Kampala Metropolitan.
Thank you so much, Robert Onyango. In more stories, hundreds of residents got stranded at Busia-Toro border after they were denied chance to access their home districts. This was during an operation by security personnel aimed at enforcing inter-district movement restrictions as per the presidential orders.
Football in Uganda continues to grow in appeal that attracts sponsors. Toro United has become the latest to benefit from one X-bet that has pumped 113.8 million shillings.
We are going to consider it. It's like the good cooperation. A good cooperation entails everything. Yes, once we keep together.
We're so sorry about that glitch. We'll have the details of that story later on at 10 p.m. for more news. Now, police in Jinja have this morning mounted an operation to impound vehicles breaching the guideline on movement of vehicles from one district to another. President announced a partial lockdown a week ago while restrictions on passenger transportation from one district to another as a preventive measure against the surging cases.
Security personnel in Jinja have blocked all entry points to Jinja City in a move aimed at implementing the directives against inter-district movement as a preventive measure against COVID-19 transmission. Police put barricades at various entry and exit points to Jinja City that left quite a number of people stranded on the road.
Idukira nti waneeno idinda egemagananibwa ni Nairo olisoseera district kuba tubasobola kutegeera nti ono tuwa idinda ono tuwa idinda tibali tubuza card but already we are in district inside.
At both the new and old bridges, motorists were barred from accessing the city with only a few private cars allowed to move after being checked thoroughly. However, vendors who decided to walk on foot were also allowed to access the city center after explaining themselves to the law enforcement.
The government yali wadde tukolanga bwe yakoze mukono wa Kiso ne Kampala. Batuyambye tusaze ku mmere y'abantu amanda tetulina kye tufumbisa.
At the taxi park, mostly at long-distance routes, there were no taxis, and the few available ones were also just parked. The taxi operators, including taxi drivers, have appealed to government to allow them operate mostly in nearby districts like Buyikwe, Kayunga and Mayuge, as it is the case with Kampala, Wakisa and Mukono, under strict observance of guidelines.
Government etuwemere tusobole okufuna ekyokulya, otherwise agatali ekyo twidakola utwena akatiisa kubanga abasirikale bali kunjira baliko bati tojja iganga aye ate nga ate Kampala abantu bali kuva Entebbe bali kuide Kampala badde wa Kiso.
Jinja City DPC Maurice Niyonzima says the operation is aimed at implementing the regulations intended at curbing the spread of COVID-19.
Tukiriza they are essential workers. Essential workers kitegeeza nti banga ba doctor, bakora mu kitongole ky'amazzi, abamasanyalazi, the banks, ate nabo balina clearance.
The operation left motorbicycles and vehicles impounded with movement paralyzed.
Now, moving on, doctors have discouraged the public from self-medication with COVID-19 tablets by the public. According to Dr. Richard Idro, these are said to be dangerous and harmful to an individual who is COVID-19 negative. Details follow.
Uganda is experiencing a high upsurge in the numbers of COVID-19 cases daily. These infections in the new wave are spreading at a high rate, according to the health officials. The President Uganda Medical Association, Dr. Richard Idro, says the new wave has brought in fear in the public.
In the past weeks, we have been getting over 1,000 new infections every day, and several people dying daily. This appears to have precipitated or brought about fear in the public, and has led to a lot of questions. What can people do?
The doctor says over 80% of the public do not know whether they are affected by the disease or not, resulting to big numbers of people flocking pharmacies for self-medication.
And then another 15% of persons have this mild disease, and most of this care can be provided at home. And these are mostly the people who are going to pharmacies to buy medicines so that they can be treated. But the other group who are going to pharmacy are buying medicines to hoard in case I fall sick, that there will be something.
The drugs purchased for self-medication by individuals, many are said to be dangerous to negative COVID-19 individuals, causing more harm to the body.
There are people who have been taking vitamin C that they are preventing COVID. They have been taking it for months. You are starting now to hear about abdominal pain, people having pains in the abdomen. The steroids, dexamethasone and prednisolone especially, these are very dangerous drugs. You take it for 2 or so weeks, your cheeks are going to swell.
For one to undergo self-medication, Dr. Richard articulates minimum procedures to undertake rather than buying the medication.
There's only a situation where you have somebody available, either in a family member, a friend, or in the community, somebody knows you are there. 2, that you have made a health center where you go, a health unit aware, that they can also check on you, or you can call them, that in case of emergency, you can reach there.
He urges the Ministry of Health officials to carry out more awareness and sensitization about COVID-19 to the public. Lydia Chomkama, UBC News.
The business community operating in Kampala has been given an ultimatum of 2 days to ascertain whether they are fit to continue with their activities in accordance with the COVID-19 guidelines. The warning has been sounded by the resident city commissioner, also a member of the Kampala COVID-19 task force, on an inspection tour in Kampala, noting that a massive violation of COVID-19 guidelines has been going on. Kaye reports.
Last week, President Yoweri Museveni declared a 42-day partial lockdown due to the increasing cases of COVID-19 in the country. The president directed institutions of learning to close as they observe the effect of COVID-19, giving the business community a leeway to operate with keen observation. The Kampala resident city commissioner, together with the leaders of the business community, have made an impromptu tour of the central business district to ascertain whether the standard operating procedures set against COVID-19 are being observed. At Chikubo Trading Center, the RCC was informed how Kampala Capital City Authority staff is violating these guidelines by allowing vendors to operate in the corridors, hence increasing on the numbers and violation of COVID-19 guidelines.
Enforcement officer wa KCCA bagenda ne bamanya nti omukulu wajja wano ne baloka bakuwa obusimu abantu bonna ne bava mu luguudo abali akamala okugenda ne baddamu ne beeyiwa mu luguudo kamera nizikuba ffe netubanga twononeka eri ensi yonna n'omukulembeze w'eggwanga.
Haji Muhammad Katimbo told the leaders that the vendors had been tipped off to vacate the area because of their visit. UBC TV cameras captured the business activities after the impromptu visit, and it was business as usual. Observing that the COVID-19 guidelines are being violated, Commissioner Hood Hussein warned the business community to comply or write a report recommending their closure in 2 days.
Chikubo downtown, we are watching you on CCTV camera. we are going to close you, particularly Chikuro. If you don't abide by the rules, we are going to close you.
The team proceeded to the new tax park where it was noted that there was overcrowding by stationary long route vehicles.
We are giving you up to tomorrow at midday for you to remove the taxis, the coasters that you have left idle in these tax parks. If you don't remove them, we are going to remove them and take them to an area where if you are to get it back, you may have to suffer the consequences.
On their way to Kisenyi bus terminal, the team sensitized border riders how to maintain the standard operating procedures against the virus and interacted with drivers operating in Kisenyi Tax Park, advising them to maintain the standard operating procedures against COVID-19.
Era njagala kutegeeza buli muvuzi wa boda mu Kampala Central Division yaddala mu entwalira ddala nti olunaku olw'enkyo kukwata nga tolina sanitizer ku piki ne siteegi ogisiŋŋaana nga teyinaawo mazzi na sabbuuni, eyo siteegi tugenda kugiggalawo kubanga olwaleero RCC wa Kampala tubadde naye nga tutambula ku gulawundi n'atwongera ebiragiro.
To those operating in arcades, there was no observance of the COVID-19 guidelines, with overcrowding imminent.
This is the center of the further spread of this epidemic. And we are not going to kneel down. We are not in a cocktail party really, guys. We are recommending that Kampala goes in a lockdown. Me, I'm going to recommend, because the president, the leadership is playing its part of reminding people that the disease is real.
The team proceeded to Usafi Tax Park in Kampala, where leaders were sensitized and warned against the dangers of COVID-19 and observance of the COVID-19 guidelines. At Owino Market, Ham Shopping Center, although a public address system was being used to warn people about the deadly virus, many were forced to wear masks. The Kampala Resident City Commissioner Hood Hussein is expected to write a report about observance of COVID-19 guidelines detailing how they have been abused. Sudat Kaye, UBC.
Motorists in Isingiro district have continued to transport passengers to the nearby districts despite the government's move to banning inter-district movements. In Isingiro district, border cyclists are seriously aiding the transportation of passengers from Isingiro to Mbarara through porous roads. Details follow.
Border cyclists in Isingiro district have taken advantage of passenger vehicle restrictions to aid stranded passengers cross from one district to another following the closure of inter-district border. Whereas security has managed to impound some motorcyclists, a number of them have continued to transport passengers through the porous and guarded borders. It should be noted that on Sunday, President Museveni communicated a number of measures intended to minimize further spread of COVID-19, among which included banning of inter-district travels. Along Mbarara-Kikakete Road, although police mounted a roadblock to stop both public and private vehicles from crossing to either district, motorcyclists were still seen crossing. Some police officers were seen allowing some vehicles to cross after receiving calls. Also, at some points, taxis would bring passengers and give them to the border cyclists to proceed to Isingiro or Mbarara. Police kept them under surveillance and most of the motorcyclists were impounded in the process, with some given express penalty receipts. Some of the passengers were seen carrying their luggage, walking to their different destinations, while others took advantage of some vehicle attached to a certain media. The Rizi Region Police spokesperson, Samson Kasasira, says they only allowed vehicles belonging to essential workers, expectant mothers, and the sick to cross.
As for emergencies, especially medical and other emergencies that need referral, especially within the region and those coming from other regions, like those who want to come to the Mbarara Regional Referral Hospital and other hospitals within other districts, those will be permitted on grounds that they present medical forms.
Rizi Region Police Commander Richard Eseka has urged all district border riders chairpersons to ensure they deter their colleagues violating SOPs. These also requested security to arrest and charge all those border cyclists found without masks illegally transporting passengers.
So tulina okukola ng'abakulembeze kusutukiramu ne tugamba ne poliisi ne tugenda ne tukwata abantu abataddewo stages.
They also void to intensify neighborhood watch so as to deter further transmission of COVID-19.
Kubanga kati kye tuliko toyinza kulwanirira bulamu ng'ate olagenda eri n'asitula abantu n'abaleeta tamanyi baleese oba balwadde ate n'akupakinga oludda n'akuleetera obulwadde.
Isingiro, being a border district, poses a very high risk of spreading COVID-19 since there are several people crossing from Tanzania into the district through porous borders.
In more news, the Minister of State for Higher Education, Dr. John Chrysostom Muyingo, is grateful to President Yoweri Museveni for reappointing him a minister for the third time. He pledges to emphasize the campaign against school dropouts and implementing government programs aimed at improving the education sector. Minister Muyingo says with the guidance from the Minister of Education and Sports, Janet Museveni, he will continue to caution educationists and school proprietors against sabotaging government programs aimed, among others, to improve teachers' welfare.
The appointed State Minister for Higher Education, Dr. John Chrysostom Muyingo, has cautioned parents against promoting child marriages which contribute a lot to school dropouts. Muyingo also says that through their guidance of the Minister of Education and Sports, Janet Museveni, he will work tirelessly to make sure that learners have lunch at school, improve the teaching of science and vocational skills, revamp traditional schools and improve the teachers' welfare by implementing the teachers' policy, among others.
That are needed. Prepare our tutors, prepare our lecturers, prepare our teachers, so that they prepare our children, equip them with the skills that are needed in the job market. Of course, the teacher is critical in all this, in the success of whatever we are going to do. I'm looking at pulling all our brains together to ensure that the teacher, we have a teacher who is very well trained, a teacher who is highly motivated. That will also mean, first of all, a lot of work will be done. Will have to be done in the teacher training institutions. A lot of work will be done to look into their welfare and the payment and salary, welfare and salary, even accommodation.
This was during an interview at his home at Mbalala Mukono, where he commended President Yoweri Kaguta Museveni for reappointing him in the same office.
When His Excellency President Yoweri Kaguta Museveni is appointing me Minister in the education sector, I would like to use this opportunity to thank His Excellency, the President of Uganda, for this appointment. I want to thank him for the trust he has in me. I want to thank His Excellency, the President, for recognizing my contribution to the development of this country. May I also use the same chance to thank our Mama, Janet Museveni, for the care and the support, and also for congratulate her for Mama has guided us, Mama has supported us. We thank her and congratulate her for that.
On the issue of some parents who already paid school fees before the school's lockdown, Muyingo appealed to them to remain calm and encourage school administrators not to charge against parents when they resume teaching.
Term had not come to an end. We just broke off halfway. So the money that was paid in the schools in the form of school fees for this term should be enough money to cater for the education of these children when they come back to complete the term. So I do not, and we do not expect schools to charge extra fees for the extent for the continuation and the completion of this term. The amount of money that had been paid for this term should be the same amount of money to push the schools through the next learning period.
He also encourages school proprietors to continue emphasizing the teaching of sciences and vocational skills and warned that schools without science laboratories and vocational studies will not be licensed. Salongo Freddy Kasibante compiled this report.
With cases of COVID-19 fully ravaging among school-going children, government has cautioned parents on how they should handle children while at home during the 42 days. UPDF Chief Political Commissar, who is also the representative of the UPDF in the 11th Parliament, Major General Henry Matiko, wants parents to ask children and to make them busy within their homes if they need to create more activities other than the unnecessary movements.
Operating procedures. What now we need to do with the second partial lockdown is really to study and go back to these standing operating procedures. My main message, schools have now again been shut and children are at home. Please, young people, remain at home because now this virus is everywhere. It's no longer like the first wave where we were not saying it is in some places and not other places. The places you want to go to hang out, these plazas and everywhere, any place now has a possibility of this virus. The best way, keep home for these 42 days. Listen to your parents, because now the parents have a responsibility to work with the experts to handle the infections, because the infections are now real. Many people in society now are infected, and the hospital facilities are not enough. Even when you want to go, they will first say, we take up people of a certain stage. So it's real. The hospitals are not enough to handle you. So if you keep meandering and causing more infection, as we head for the third wave, which they are talking about, the experts, we shall be in trouble. So my young people, stay home. Stay home, do your things home, even playing football, play on your phones if you can. Please, please don't tempt the situation where we are going to have many of you.
We'll take a short commercial break and we'll be back with sports news.
Today in history.
Today, the 11th June 2021, marks 24 years since the death of the late Herman Basude, who died on 11th June 1997 in a car accident. Basude was a Ugandan Kadongo Kamu musician who was born on 5th December 1959 in Masaka district in southern Uganda. Famed for his powerful lyrics in songs like Bas Dunia and Muchala Mugerwa that were released in 1986, Basude was one of the most recognizable figures in the Kadongo Kamu genre and left a legacy that puts him among the legends of the Ugandan music industry. But above all, it is shocking that he chose to use a road accident to present the deterring livelihood only to end up dying in a real road accident in 1997. More in a manner of the Bas Dunia song.
We've cut and reduced our MTN Momo withdrawal rates. Now you can withdraw mobile money at the lowest rates. You also get MTN Central Points when you deposit, send, and withdraw MTN mobile money. Visit our Momo agents countrywide and withdraw mobile money at our reduced rates from 1st May 2021. Everywhere you go, MTN.
Ekya COVID-19 kijja kugwa
If we get vaccinated now, observe social distancing, wear masks properly, sanitize or wash our hands with soap and water regularly. Together we can defeat this enemy.
Mukazanyo ka chess kisoboka ebitono okufuuka ebinene. Kyekimu wano na wano. Tunula nkaliriza buli lutambula. Wandiika buli namba osobole okweteekateeka obulungi. Nga tofuddeeyo ku bunene bwa kirooto kyo. Manya nti abawanguzi b'enkya beeba bakuuma ebitabo byabwe nga biyonjo. Yanjula kati ennyingi zaayo n'enfulumya.
Uganda Revenue Authority, developing Uganda together.
In efforts to improve quality assurance and Uganda's competitiveness as a tourist destination, Uganda Tourism Board is set to undertake a nationwide grading and classification exercise of hotel and accommodation facilities. As a member of the East African community, Uganda subscribes to the East African Grading and Classification Criteria, a system denoted by stars ranging from 1 to 5. The grading and classification exercise will be crowned by the awarding of star ratings to facilities found compliant to the EAC minimum standards. This is therefore a call to all accommodation and facility owners and managers to register and get licensed by UTB as a requirement and get ready for participation. For more information, visit www.utb.go.ug or email qualityassurance@utb.go.ug for details. Uganda Tourism Board, promoting tourism together.
It's Freaky Friday from Airtel. Buy or gift. Buy or give.
Get freaky too! Dial *149*10# to load a Freaky Friday bundle for you to enjoy the best offers on voice and data.
To buy a bundle for friends and family, dial *149*10*4#. Freaky Friday with Airtel. Buy or gift a bundle today. Dial *149*10# to get started. Airtel, the smartphone network.
Welcome back from that short commercial break. In our sports news, the Copa America will kick off on Sunday during defending champion Brazil against Venezuela at the Mané Garrincha Stadium in Brasilia. The final will be on the 10th of July at the Maracana Stadium in Rio, one of the COVID-19 epicenters in Brazil, where more than 480,000 have died from the coronavirus. No spectators will be allowed to attend any Copa America matches because of restrictions in place for the pandemic, which has already delayed the tournament by a year. Brazil players ended speculations about a potential boycott by issuing a unified statement on Wednesday saying they are unsatisfied with the decision to move the tournament to their country, but it wouldn't stop them from representing their national team. And if South American World Cup qualifiers are anything to go by, the Copa America title is Brazil's to lose. Brazil has won over 6 of their games and is 6 points clear of second place Argentina. With the likes of Neymar on board, Coach Tite expects not only to defend the title they lifted in 2019, but also use the next 30 days to prepare for 2022 World Cup in Qatar. Argentina were placed third in the 2019 Copa America, but they have improved under coach Lionel Scaloni. Defender Christian Romero and midfielders Leonardo Paredes and Giovanni are now trusted to break the opponent's lines. Up front, Laturo, Martinez and Sergio bring the same respect. Thank you so much for watching UBC News tonight at 8 p.m. Do join us again at 10 p.m. for more news coming your way. Have a good night.
Many people who fell sick with coronavirus in March or April are still not fully recovered. Their struggle shows how problematic this virus can be.
Ich will
You're watching the conversations on the budget for financial year 2021-2022, and joining me now is the chairperson of the Uganda Manufacturers Association, but also the executive director of Nice Household Plastics, Ms. Barbara Murana. Thank you so much for joining us. I wanted to ask first about the budget and if it speaks to what's been one of the biggest concerns, the cost of credit in the market.
Thank you, Morris. It's always nice to